afternoon, everybody, and welcome to this afternoon's event. It's a very special day today because today the world focuses on what else we need to do to achieve the Millennium Development Goals. Now, we have over 100 people from different faiths, but we are also going to be joined by thousands online who are all going to be emailing in questions to our esteemed panel. Now, I want to explain the arrangements to you a little bit. Basically, what's going to be happening is we will be taking speeches from our panel, then we'll have questions from the audience and also from our viewers from all over the world. And then finally, we will break in time for the fast at 6:40 today. So for our Muslim guests among us today, you needn't worry, we will have time to pray in time for sunset. Okay, so without further ado, I'd like you to watch this small film and then our panel will be joining us. Thank you for coming, everyone. Thank you.
We all instinctively want to protect our children, but in many parts of Africa that's not so easy. Imagine being the parent of a small child there. I'm with an organization that works to prevent malaria around the world. Each year, more than 1 million people die from malaria. It is the #1 killer of children in Africa. And Latin America and South Asia are hugely affected as well. What makes this so unacceptable is that it's completely preventable. Families need to understand how to protect themselves from malaria. A bed net impregnated with insecticide will repel mosquitoes and save lives. We have the nets. They're making them in Tanzania, and soon they'll be making them in Nigeria. And they only cost £5. We need to educate families who don't have access to the nets on how to use them properly. The problem is that the poorest families don't get the nets, and it's their children that are dying from malaria. And this is where faith communities come in. They can reach the poorest and most isolated families. We can stop malaria. These deaths are completely preventable.
I think you'll agree after watching this that we face a big challenge. 1 million deaths are entirely preventable. A lot can be done, and it is being done. But what's more, you can do something. Buying a bed net for an African family that cannot afford it is a great start. We called this film The Story of a Bed Net. But the last chapter is still to be written. That chapter would be about how a generation of people of faith believed they could work together to wipe malaria from the face of the African continent. But we have to write that chapter together, beginning today.
So, without further ado, ladies and gentlemen, will you please put your hands together for our panel. Salima Abdul Ghafoor, Tony Blair, and Shaykh Hamza Yusuf. Welcome, welcome everyone. I will give you a little bit of information about each of our panelists, and then I'll hand over the mic, and you'll all be able to talk and take it from there. Now, first of all, we have the lovely Salima Abdul Ghafoor. Now, Salima works for Malaria No More, an organisation formed in advance to help advance the UN Millennium Development Goals. Now, Salima, do you want to tell us a little bit about what you do and what you've achieved so far?
Absolutely. I first want to say Assalamu alaikum and peace be upon everyone here in the room and to all of our folks who are online that I know have logged on all over the world for this event. And I also want to say thank you for moderating this conversation. And it's an honor to be here with folks who have such a long record in public service, Prime Minister Blair and Shaykh Hamza. So it's really an honor and a pleasure to be here. And I certainly do bring greetings from Malaria No More. We are headquartered in New York City, and our mission is to end deaths due to malaria in the world. I don't know if now we should talk more about. I want to give you all some information, and I'm just going to read it so that I make sure I don't miss anything. This day today is about saving lives. You're going to hear from youth and faith-based communities out in the field doing amazing humanitarian work. You're also going to learn how you can get involved, and we hope that you will. We are about at the halfway point to the Millennium Development Goals. The 8 Millennium Development Goals were formulated with the premise that we have the human and capital resources to end extreme poverty in our lifetime. Thousands of public and private world leaders signed on to the Millennium Development Goals in 2000, and if we achieve these goals by 2015, we can end extreme poverty. What are the Millennium Development Goals? I think it's important to say because oftentimes people don't know. The first one is to eradicate hunger. The second, to achieve universal primary education. The third, to promote gender equality and empower women. The fourth, reduce child mortality. The fifth, improve maternal health. The sixth, combat disease, specifically HIV/AIDS, tuberculosis, and malaria. The seventh, ensure environmental sustainability. And the eighth, global development partnerships. I'm going to focus on the global community's work to end malaria-related deaths. Malaria is a disease transmitted by a mosquito, and it is a disease of poverty. Let's do the stats for a moment. 50% of the world's population, that's about 3.3 billion people, are at risk of malaria. Nearly 1 million people die every single year from this disease. 3,000 children die every day from this disease. Malaria permanently maims adults, and it kills pregnant women and children. It is the #1 killer of children in sub-Saharan Africa, more than HIV/AIDS and tuberculosis combined. It costs the African continent about $12 billion in lost productivity. That said, to get to the positive after that dreary news, we know that if we boost malaria control efforts, we can significantly advance 6 of the 8 Millennium Development Goals. We also know that this is a winnable issue. Right now, we know that malaria is a disease of poverty. We know that it's about the equivalent of dying of a broken arm. We know how to fix this. We know how to treat it. We know how to prevent it. This is not a hard win for us. This is just a win that we can have if we put our will to it. The tools